Greetings to you all, Aurum colleagues. It's the 9th of July today, and I've been mulling somewhat reluctantly over making this video to guard against the presumption of things in this COVID epidemic that we're all too familiar with by now. But I think it's important for you to know, and I don't really have any fear in saying it, but I was tested COVID positive on the 29th of June. And have been working my way through this experience, my journey, so to say, for the last 11 days. I've waited to share this information, not because of a fear of stigma, but rather to see how my own path unfolded. The first week was almost a case of, what's the fuss about? I was pretty much asymptomatic, and I carried on working the same as always. In quarantine, of course. But after about 6 days, the virus showed up. Flu-like symptoms, aches and pains all over, and a dry cough. Oh, and fatigue. But no fever somehow. And despite the way I felt, I'm glad to say that throughout this whole experience so far, my blood oxygen levels have been well over 97%, which is normal, and this was very reassuring. So it does appear, at least in my case, that the course of this COVID is, as described in the media and the medical literature, no symptoms at all, or mild to moderate symptoms for 90% of the people. And in my case, very much so like having a very bad cold. So where did it come from? Or was I irresponsible in social distancing and hand hygiene? No. Did I fail to wear my mask or foolishly visit other people when I shouldn't have been, knowing what the risks are? No. It came from doing what healthcare workers are supposed to be doing, helping others on the front line. You see, my wife, she's a specialist physician working at a local hospital, and she and a nurse colleague were resuscitating a desperately ill COVID patient when the ventilator went wrong and broke down. So they were faced with a very difficult choice: watch him die, or resort to manual ventilation for well over 2 hours whilst they fixed the machine, knowing that it would shower them with virus despite all the PPE that they were wearing. They both unhesitatingly chose life over self, and both were infected as expected. My wife came home in absolute shreds, and we agreed that we would walk this path together rather than banish her to some hotel or quarantine space like that. And I'm comforted to know that the patient is making slowly but sure progressive recovery, and the nurse is also stable and getting better slowly. But why am I sharing this with you today? It's because I want you all to know, especially the Aurum colleagues working in the front line, that I appreciate your fears and I doubly value your dedication to the work that you're doing. And I want to thank you for continuing to battle in each and every day for the sake of others in the community. It is what we were all called to be. It is what we are called to do. And although I'm, by God's grace, not critically ill in hospital, I do know the comfort, especially now, of the presence of other colleagues and nurses and frontline staff who support all the nurses and doctors who are prepared to make the sacrifice of self to help people like me. And many others who are struggling in this cold weather right now with deep uncertainty, bewildered and unsure of what's next. Colleagues, please do whatever you can to stay safe, follow the guidelines, use the PPE. This disease is no joke. But if you do become infected, and more of us are, rest assured knowing that there are other people, other healthcare workers like you, who are willing to stand in the gap. And I know you will help them in turn also when it is your turn to help. I pray for continued strength for all of us, healthcare workers and support teams, and I urge you to continue to be available to serve others, whether you're COVID positive or not. God bless. I'll keep you in my thoughts and prayers. and let's hope that we're all available to help the many others as we get through this together. Thanks so much. Cheers.